Hey, this is Dr. Marisa Hoyne over at Kalispell Direct Care, and I am excited to talk to you today about a new treatment for sleep apnea. So here is the journal article. It is Tirzepatide for obstructive sleep apnea and obesity. This is a New England Journal of Medicine article. It was published in June of 2024. And a little bit about who wrote this. So the main author's last name is Malhotra. Sorry if I pronounced that weird. But listen to this group of people who put together this study. Now, it was sponsored by the Eli Lilly company, so keep that in mind. But listen to this group of people who did this. So it's from the University of California at San Diego, a university in Sydney, Berlin, the University of Illinois in Chicago, University of Pennsylvania, Brigham and Women's, and Harvard. Sounds like a dumb group of people. No, it doesn't. Okay, so this study is one where they're taking people who have known obstructive sleep apnea, and what they're measuring is the amount of apneas or hypopneas, which is basically the amount of times people stop breathing while sleeping per hour. So it's a study where they either give people a placebo injection or this medication injection. The medicine is Tirzepatide. That one's also called Mounjaro. That's the diabetes branded name, or Zepbound, which is the weight loss branded name. It's a once a week injection. So it's placebo controlled, it's double blinded, which means that both the patient and the researchers don't know which one you're getting, but someone's got that in a database somewhere. And then it's randomized, so you get kind of randomly selected to be in one group or the other. So they did it in two different sleep apnea populations. So the first group they tried was people who are not using a CPAP, and the second group they tried are people on a CPAP. And they had them take the medication for 52 weeks. The group without a CPAP started at 51 events per hour. So if you think about, those people were not breathing 51 times. I mean, that's really a lot. Just think about how hard that is on your body. And then the group with the CPAP was at 49 times an hour. So separately, the group that was not using a CPAP, at the end of this intervention, they had lowered those amount of events hourly to lowered it by 25.3 events. So that's about in half, right, of 51. And then the using CPAP group lowered from 49, they lowered it by 29 events. So, wow, what an amazing intervention. Really is helpful for CPAP or for sleep apnea people. And that's only for 52 weeks. Like, you kind of wonder, had it been a longer study, would we have seen even more results? I don't know. But anyway, it's so exciting that a medication can be used for sleep apnea. Of course, it can have side effects. They're usually GI things like diarrhea, constipation, sometimes nausea and vomiting. But if you have a good doc who knows about these things, hopefully they can help minimize that risk as well. Yeah, I'm hoping that insurance companies and Medicare will actually cover that, because that's the real deciding factor for a lot of us about if something's used or not. But anyway, that is I have two more things I want to say about it. Stop the summary statement. Okay. Of course, this lowered the weight in the people who got the medication. It also lowered inflammatory markers. So I hear people always asking what can they do that's anti-inflammatory. Also lowered blood pressure, and it was a total of 469 people in these studies. So that's always the thing I worry about with a lot of studies that I see is, are there enough people? If you do a study of 20 people, your chance of having a not quite correct conclusion from that is much higher than if you have a higher powered, bigger study. So I love that this had more people. So that's my study for today. FDA approved medication for sleep apnea. And I hope everyone's having a great day. Goodbye.